What's going on, everyone? Happy Tuesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Tuesday edition of the Pandemic Update for Tuesday evening, December 19th, 2023. That's right, we're getting ever so much closer to Christmas. Starting off today, if you're new to my channel, welcome to my channel. If you like this content, maybe you were wondering, a video about COVID? Yes, COVID is still a thing, and there's a lot of other viruses that are a problem out there to you. Let me prove that to you. If you thought the pandemic was over, it's not. So if at the end of the video you like this content, give it a thumbs up and subscribe to my channel down below. Alrighty, starting off today, new study proves that COVID-19 is far more harmful and deadly than the flu. Do we really need a study to prove that? I mean, take a look at the flu deaths compared to the COVID deaths. Yeah, we had 1,700 COVID deaths last week. We didn't go anywhere near to 1,000 flu deaths last week. So, yeah, COVID is definitely far more deadly, and plus, long COVID is far more harmful than the flu. All right, moving on to this. The WHO classifies COVID variant JN.1 as a variant of interest due to rapidly increasing spread. So yes, the JN.1 variant is continuing to get more attention, and it is something that is definitely concerning here in the United States and all around the world. All right, repeating this from yesterday, in case you did not see, new cases. There were 274,000 last week. And the deaths last week, like I just said, it was close to 1,700 deaths. 1,693. We're not even at the peak of cases going up, and yet deaths are continuing to rise. This, my friends, is not a good thing. Hospitalizations across the country continue to rise, and boy, are they ever rising. Wait till you see New York State in just a few moments. Taking a look today at the latest air quality data, it's not all that bad out there. I mean, we do have a few spots that are concerning, with the biggest concern being on the West Coast, and some of these Gulf Coast areas are also a concern as well. I know it's not coming up here. Eventually, it will come up. And you can see here, there are still some mountainous problems out on the West Coast. The major cities on the West Coast are not bad. Pacific Northwest, Seattle. I should note that Seattle, you can see here, there are some oranges and reds popping up there. Let's take a look at the Walgreens numbers for this week, and we'll see that the national positivity at Walgreens actually went down a little bit. That's because testing went up. 29.2%, that's down 0.3%. 22,167 tests done in the past week. Let's take a look at a few states now that we did not yesterday. Illinois' positivity rate is 38.9%. The prior week was 38.5%. That was up 0.4%. 1,953 tests versus 1,844. Ohio, 39.9% this week. The prior week was 32.4%. Difference of up 7.5%. Total tests 591. Prior week was 568, and we do know Ohio cases have been rising. Alabama, 21.4% this week. The prior week was 19.2%. Difference of up 2.2%. Total tests 290 versus 245. How about Oklahoma? We don't give enough attention to Oklahoma. That's simply because Oklahoma does not have much data, but they do here at Walgreens. 31.9% positivity rate this week versus 30.5%. That's a difference of up 1.4%. It's 254 versus 243 tests. So, yeah, testing's up, but hey, cases still rise. How about Kansas? Kansas, 33.5% this week. Prior week was 31.1%. Difference of up 2.4%, 200 tests versus 151. So, yeah, everything went up there. Maryland, what's going on there? The positivity rate in Maryland this week is 31.3%. The prior week was 25.2%. Difference of up 6.1%. Total tests 214 versus 119. Big increase in testing, but hey, the cases still went up because the positivity went up. How about somewhere that's dropping? Now, they don't do much testing in Wyoming. 12.5% versus 16.7%. That's down 4.2%, but total tests, just 16 versus 12. So, yeah, they don't do much testing. Idaho, not much testing either. 29.5% this week versus 30.8%. That's down 1.2%, 44 tests versus 39. Now let's take a look at Alaska and see what's going on there. In Alaska, we see the prior week was 44.4%, but just 10% this week. Down 34.4%, but total tests, look at this. 10 versus 18. They're not doing very much testing, but hey, it still dropped, so that's a good thing. Now let's take a look at some wastewater data. Let's just glance around the country, and we can see the Great Lakes continues to be the biggest problem. If you haven't been following my videos, we've been watching this in the Great Lakes, this red, these oranges, and red. That's 80 to 100% COVID detected. That's really bad, and it's been spreading outward. Look at this. It's actually starting to make its way over to the Appalachian Mountains. Look at western North Carolina. That's really bad. Look at New Jersey. New Jersey's not doing all that well. Let's just click on a couple sites in New Jersey. Here's Monmouth County, New Jersey. That's bad. I mean, look at this. You can see a lot of red. Morris County, New Jersey. What's going on in Pennsylvania? I'm curious. Center County, Pennsylvania. Wastewater's starting to go up, and that's with Penn State students. That's where Penn State University is. Huge university in Pennsylvania. Penn State University, they're starting to go home now, and wastewater is up. And wow, look at western Pennsylvania. Bad. And let's just go somewhere else real quickly. How about we go out here to Pacific Northwest? What's going on there? I'm curious. Yeah, you can see here. Oh, wow. Pierce and King County in Washington. Yeah, that's not good. But we also want to go a little deeper. We want to check a couple of those wastewater scan sites to see what is being detected there. So let's come down here to the Louisville, Kentucky area. And we already see that COVID is high, and wow, it is rapidly rising. RSV is high. That's rapidly rising. Influenza is low. HMPV is not too bad. Norovirus is high, and it's going vertical. It's almost rapidly rising. We come down here, no detection of Mpox, some minor detection of hepatitis A at this time, and we'll keep this going. We will do one more site. How about we come down? What's going on down here in Louisiana? Remember New Orleans, I think, just came on recently? Let's see. I'm curious to see what's going on here. And yep, right off the bat. It started on November 27th, and it's been up ever since for COVID, RSV, influenza. HMPV is down. Norovirus is dropping. How about Mpox? No Mpox detected at this site. And should we do one more? Why not? I'm feeling nice. Let's go out to California and see what's going on there. Let's just randomly go somewhere in California. We'll come up here. How about we come down to San Jose and see what's going on there? Whoops. Not looking good. I'm seeing high. Wow. Rapidly rising for COVID. RSV is now starting to rapidly rise. Influenza A is starting to rise faster. B as well. HMPV is rising. Norovirus is medium. Overall trajectory is upward. And let's see. They did have a couple detections of Mpox back in October, so that is not good to see. All right, continuing on now. We know COVID's growing in most places. It's declining in a couple places. We'll have to see if that continues. Taking a look now at the latest variants, HV.1 is 29.6%. JN.1 is at 21.4%. This is likely wrong. JN.1 is likely progressed further. It's probably at or above 30% now. We will hopefully get an update on this on Friday. Whether we do an update from here at home or out in the wild, I will make sure I get that new number out to you. Taking a look here at hospital admissions for the past week, 23,432. Again, new update on that Friday, and this is not good. EMS calls in Philadelphia yesterday, 854. It's clearly respiratory season, and something else I don't like seeing here that's unrelated to the pandemic. Yeah, 200 fire incidents in Philadelphia yesterday. Whew, that's a really busy day for the fire department. Not too bad right now for Montgomery County. Mind you, it's 7 o'clock at night, but check this out. This is not good for 7 o'clock at night. Chester County, Pennsylvania. Look at all these calls. Respiratory difficulty, sick person, falls, stroke, pains, unconscious person, heart problems. Yeah, not very good. And speaking of not good, I got some not so good data coming ahead. First off, New Jersey. With only 66 out of 70 hospitals reporting, meaning 4 did not report, New Jersey is now up to 830. I am just going to go out on a limb and say at this point, before New Jersey peaks, they're definitely going to go over 1,000 hospitalizations. But might I add, that is lower than previous years. But again, let's not get caught up on that. There have been so many cases. I've gotten comments here. I've gotten messages sent to me. I've seen comments on Twitter. People are having COVID. They're in the hospital. They're not testing for COVID, and then they do a test on their own, and hello, surprise, it's COVID, or they're sick and they're just not getting tested. There's a lot of hospitals that are not testing to see if someone has COVID, and it's really ridiculous. It needs to be brought back. On another note about hospitals, I did not put it up here. UPMC, which is a healthcare network in Pennsylvania, it's a healthcare, you know how you have healthcare agencies. Well, there's UPMC. They operate several hospitals in Pennsylvania. They are going to bring back mask enforcement for all staff members. I did not see if that's going to include visitors and patients. I am assuming it will, but yes, masking is coming back at UPMC in Pennsylvania. New York State, 2,728 new cases. Let's just refresh that to make sure. Yep, that's correct. So yeah, New York State's going to be coming in higher this week. And take a look at this. So they ended last week at 1,828 hospitalizations. They're now at 2,077. New York State saw a major increase in hospitalizations today, and we'll have to see if this continues. It may just bounce ever so slightly lower tomorrow and then continue higher. We'll just have to see what happens, but this is not good. Look at the hospital admissions. Let's take a look at that as well. And you can see here, hospital admissions. Hang on. We're getting it. Hospital admissions. Look at that. They are going upward at this time. So, yeah, look at that. They are literally now the highest since we have to go all the way back to February of this year is the last time that we have seen them this high. Tomorrow we will hopefully get Texas and we will get some other states. I don't know if I'll be bringing that to you tomorrow. We'll just have to see. Tomorrow's pandemic update may be out in the wild. Matter of fact, to be honest with you, tomorrow, Thursday, Friday, maybe even Saturday, may be all out in the wild updates. But in those cases, I will have my notes and I will add to my notes throughout the day. It's busy times. Today, I did a package route this evening. That's why we're so late in doing today's pandemic update. Hey, it's Christmas. There's a lot of deliveries right now. COVID's up, and you know, these apps, they just toss anything and everything at random times of the day, which is a good thing for me, but it happens when we least expect it. I mean, the package route this evening, like, oh, surprise, yeah, I'll deliver 8 packages from Walmart, so that's all I have for you today. I'll have some more news items for you tomorrow. I'm going to tweet out a whole bunch of things this evening. Just stay safe out there. We're doing close to 1 million cases a day in the United States, and it's only going to go up higher. Christmas is going to be, yeah, the big eruption of cases. We'll probably fast track to 1.5 million before sometime on a nationwide level, sometime in early January, we will peak. Not all states will peak at the same time. Some will take a few weeks later. Some will peak early. It's going to be a mixed thing, but these next few weeks, my friends, they're super dangerous. And if you do test positive for COVID, we have a video about that down below. We did it on Sunday. Follow those steps. Quarantine, stay home. If you can stay home until you test negative, do so. If you're sick, please rest as much as possible. I will see you guys all again tomorrow. If you like this video, thumbs up. If you want more content like this, subscribe down below. That's the best thing you can do to help keep you and your family, loved ones, and friends safe. Share this with anyone who needs to see it. If you got comments, leave them down below. Maybe it's something you would like to see me do. I may have a couple special videos coming next week. I usually give myself the week between Christmas and New Year's off, so who knows, I might do some special things next week, like a year in review, something like that. If you got anything that I didn't add that you found, tell me down below. Alright, I will see you guys all again next time. Until I see you again next time, stay safe everyone, and have a fantastic Tuesday evening. Thanks for watching.